Connolly. I'm the podiatrist with Commonwealth Orthopedic Centers based in Northern Kentucky. For this video, we're assuming that you've just had part or all of your nail removed permanently. That's a procedure called a matricectomy. It's usually done with an acid, and what we're going to be teaching you is how to treat an acid burn in a small area. The first thing anybody asks about is pain relief. The bottle of Novocaine that we use normally says that it'll last about 4 hours. Sometimes that's an hour and a half. Sometimes that's all day. Whatever the case, whenever this toe starts to wake up, whenever you start to feel a bit of pain again, take what you would take for a headache. Aspirin, Nuprin, Tylenol, Aleve, all of these will work very well if you take it early enough. If you wait until you have a mountain of pain, it may not work as well. But if you start at a molehill of pain, these things work very nicely. Certainly if you're working with a child here, you don't want to use aspirin. Follow the directions on the bottle after that. About half of my patients will take the first pill and say, I didn't need any more. It doesn't bother me if you take days worth, as long as you're covering your pain and going on about your business and doing what you need to do. The second thing we want to talk about is your activity level. The day we do this, you want to go home and you want to put your foot up and you want to relax. It is not ready for you to get out and do a whole lot of things. Certainly we don't want to lock you down entirely. You're able to answer the phone, you're able to change the channel on the television if you can't find the remote, and you can get up and go to the bathroom. I don't want you cooking the meal. I don't want you going to a movie. I don't want you going to a restaurant. It's just too much time with your foot down. Once we get through that day, starting the next day, your activity level is very simple. If it hurts to wear it, you shouldn't be wearing it. If it hurts to do it, you shouldn't be doing it. And if it doesn't hurt, it doesn't matter what you do. We've had people do 18 holes of golf the next day. We've had waitresses go back to work the next day. Obviously, that's a lot of pressure on the foot, and it hasn't been a problem. The third thing we want to talk about is bandaging. The bandage that you leave the operation with is a very thick, very dumpy looking bandage that isn't a very good bandage. It needs to be that thick because it's catching blood from the procedure. We don't want to keep anything that thick on for very long, and we'll have you take that off tomorrow morning. And in some cases, when we do this early enough in the morning, I'll let you do that late in the evening. After that, what we want to do is we want to have 24/7 moist, clean coverage of this area to allow it to heal. We want to bandage it with polysporin and a Band-Aid. When you take the bandage off at first, what you want to do is take your normal bath or shower and then follow that with a warm, clean, soapy water soap. Warm, not hot water is preferred. And dishwashing liquid or hand soap or Epsom salts will all do the job. It'll be a clean drawing solution. You want to soak for 10 minutes, dry the toe off, and then bandage with polysporin and a Band-Aid. That should be continued daily for the next 2 weeks until I see you again. Someone who has some idea of what they're doing will say you should dry it and let it heal that way. That's not correct, not in this situation. 24/7 moist, clean coverage is the key. The final thing we want to talk about is what could go wrong in this kind of procedure. It's an acid burn. It's going to be a little red and a little swollen. It's going to ooze a thick sweat, maybe a little straw-colored, maybe a little blood-tinged. Those all sound like they look awful, and they're completely normal. What you want to call me for is something worse than that. If it's oozing a thick sweat, it's okay. If it's oozing pus, which is tan and smells bad and hurts, that's the kind of thing you'd want to talk to me about. If it's red and swollen just in the area of the nail, that's fine. If the redness and the swelling is back near the base of the toe or going onto the foot, certainly you should call me. And always pain would be a key. Many people don't have a lot of pain with this procedure. If 5 to 6 days later you're developing pain, you can always give me a call and see if that's a concern. I'm Dr. Matt Connolly with Commonwealth Orthopedic Centers.